Well, good morning, everyone. It is Tuesday, December 2nd. Let's say it's the calm
Wednesday.
This
Girl,
I
actually thought, oh yeah, it's Tuesday.
Here we go. Let's
Tuesday. We're just
rewind.
forgetting that Tuesday happened because yesterday was so traumatic.
Right. No, here's the thing. I was off Monday, so it's my
There you go.
Tuesday. Yes, you are right.
You know what,
Thank
though? I believed you. I believed that it was Tuesday.
Thank
So
goodness.
let's just let that point be known.
Teamwork makes the dream work. Thank you, Lord. It is a Wednesday, December 2nd. I'm Danielle Wiggins with Maureen Kyle, Holly Strano, and Dave Sadowski on the go. Josh Bischoff in Austin is covering the teacher strike out in Cleveland Heights and University Heights. So today, though, we're talking about some news that came out overnight in terms of the COVID-19 vaccine. And we want to hear from you. When the vaccine is available for mass distribution, will you get it? Let us know. A comment in the section here. You know, this is the On the Go post show where you are a part of this conversation through Facebook and YouTube. So Maureen, you were on that story this morning. What's going on?
Yeah. Well, first of all, for everybody who's watching and is going to comment, this is a decision that you don't have to make immediately. This is something, unless you are a healthcare worker or somebody in a nursing home or nursing care facility. But the big news, this is what we've been waiting for. We've been talking about Pfizer and BioNTech's vaccine. We've been talking about Moderna's. Finally, in the UK, so this is in Britain, they have approved, their equivalent to the FDA has approved emergency use of the vaccine. Everybody who's watching. So that means, okay, so that for them, the way they're going to process it is they actually focused on nursing care facilities, long-term care facility residents first. That is, you know, we're the other big news. CDC says for us, it's going to be healthcare workers. For them, they say it's going to be nursing care facilities and elderly first. The problem with that is getting the vaccine out to them. So they're saying even though they are going to target the elderly and those in nursing care facilities, it's most likely going to be people, healthcare workers in hospitals, anybody in a hospital that is going to get it because that's where it's going to be administered. But they have 800,000 doses ready to go next week. Wow. So for the bulk of us, this is going to be something that we are going to be dealing with next year, which isn't that far away. We are on December 2nd here. So next year is only a month away. But this is big because this is the first time that people who are in non-clinical trials are going to get the vaccine. So this is the first round of vaccinations. Pfizer, BioNTech, they're in Belgium. The vaccine has to be kept at a very cold temperature. So the shipment made its way from Belgium to Britain, and they're going to be the first ones to use it. We are on the same path. We need the FDA to give emergency approval for use outside of clinical trials. So that's where our holdup is, but that could be any day.
So I'm hearing from a number of you chiming in when that vaccine is available. Would you get it? So Jean Rosie or Rossi, she says no. Nicole, no. And then Nick was watching from Westlake. Becky, nope. Stacy, no thanks. No vaccine for me. And not enough info on long-term effects. And Kim, no. So no yeses for right now. Everybody saying no. Let us know, why is it the no? And for us, as Maureen, you said yesterday, we found out the CDC, they said that the people who would get the vaccine first here in the US would be those healthcare workers, frontline workers, and then those who live in long-term care facilities, those vulnerable. But again, it would be up to the states to kind of determine that. That's the CDC recommendations. But again, is it that people feel that it's rushed? What do you guys?
Right. From what I've heard from a lot of people and listening to all sorts of different news from around the world, I mean, the concern here is what are the long-term effects? And, a vaccine. Some people feel like it was rushed for political reasons or it's rushed for social reasons. And so there are some nerves about getting the first round of vaccines. It's kind of like, my husband told me a long time ago, you never want to be driving the first car off the line. What if there are bugs in it? What if there are some issues with it? But I was talking to a friend who is in the medical profession, and she was saying that that she would take it. She was talking more about, if you are not in childbearing age, that's what, an issue a lot of women have with it is not, what does it have on fertility? What kind of effect does it have on fertility or your kids, passing it on to your kids? So, I mean, we're starting with a very vulnerable population. I think of my grandma who's 104 and a half, and she's in a nursing care facility. If she gets it and there's a long-term effect, would we even know? And medical professionals, they might have a different take on how it would affect them. And they're used to medicines, vaccines. I've heard a couple of them say, if Dr. Anthony Fauci takes it, I'll take it. I mean, there's a lot of mixed reviews though. I mean, but for the average public, will you take it? And jury's still out. I don't know. I have my concerns. I have some reservations, but we'll see how it rolls out.
Well, the immediate thing we heard from one of the doctors, Maureen and Danielle Holly this morning, was that the immediate effect was that your arm would be very sore, and you would also have fatigue and other issues that could come through it. I know typically with a flu shot, some people have reactions, some don't.
They were saying, so there was a couple of medical experts talking on NPR the other day about this exactly. And whenever you go to get the flu shot, a lot of people say, well, I get sick from the flu shot, and you do have sort of a reaction. But they were saying that this might be, if that's the way you react, you always get the flu shot, you always have a little soreness in your arm, that's going to happen. And then if you do react like with flu-like symptoms, they might be a little bit more severe. This is what the medical experts on NPR were saying the other day, that you might have more of a reaction to this shot and this vaccine than you would even a flu shot.
And along those lines, Maureen, I think about the story we had this morning, the Verify, where, sometimes people get the flu shot and then they say, well, I got the flu because I got the flu shot. People thinking that they're going to get coronavirus because they get the COVID-19 vaccine. And our Verify said, no, there's no coronavirus in the vaccine, so you will not get it. But also kind of piggybacking on what you said, your husband said about you don't want to drive the first car off the lot. Beth Stanley says, well, she doesn't want to be the oops. So, with the vaccine, that's why. But we do have our first maybe. So Comer says, maybe I'm going to do a wait and see approach. And actually, if we're not in healthcare, if we're not the first line or in those nursing homes, the nursing home facilities, all of us will be waiting and seeing to see how the vaccine really impacts those who take it, because I know all four of us, we won't be along the first lines. I think all of us will probably be the last to be able to get it.
Yeah.
Well, you have to think about
the CDC has said that when they say healthcare workers, they're specifically starting with people who are caring for COVID patients. So that doesn't include, unless, I don't know if anybody here on our Facebook Live is one of those people, but I mean, for the rest of us, it's going to be months of waiting. I mean, unless you are directly working with COVID patients, and that's what they're concerned about is, even just, what was that, 2 weeks ago when there was one day where the Cleveland Clinic had 1,000 doctors and nurses out because of COVID. And so they want to make sure that they are staffed and they're ready to take care of patients who are coming in with symptoms. And those symptoms can go from mild to severe very quickly. They've told you that from the whole get-go, that, they need to be prepared. And of course, with the holidays, they're preparing for this rush. So the vaccine is timing up with this surge that they're predicting.
Yeah. And Dawn, she chimes in. She says, I'm a teacher. She's in school face to face. She said, I think she will take the vaccine so that she can remain in school. And she said it is a difficult decision. In fact, my husband's a teacher, and I asked him yesterday, I told you all on this text, like, hey, babe, what do you think? You think we should get a vaccine? And Well, I'm still waiting for his answer. Hours later, he just, I don't know, just kind of like, I'll just pretend like you didn't ask me that. So we'll see. And Tennille Henderson says, I feel like they can't kill off the healthcare workers. They need them to take care of us.